and supporting tweens with experiencing suicidal thoughts. So I'm Arvin, Senior Counselor at Children's Society and the Clinical Lead for Flourishing Minds. So I'll just bring you through the first part of today's sharing, which is connecting with tweens who have suicidal thoughts. So this is really the younger ones who are like 12, 13, 14 years old. How can we connect with them and journey with them as they experience suicidal ideation? Okay. So I think as we start, let's just have a group agreement. So can we just treat each other with respect, maintain confidentiality? So I will share a bit of the cases that I do work on, have empathy for each other, and let's be open about the sharing because this is a very heavy topic. And I think it will touch on a lot of the work that we do. So then if you feel overwhelmed or if you feel that you need to step away, please do access the resources we have available, like Mindline, 1771 or SOS, or even contact the SCFL facilitators in the room lah. So as we start, so just a quick check-in with everyone. So I'd like to share everyone's experiences in terms of managing and working with tweens with suicidal risks. So can I just get a sensing from the floor? Has been your biggest challenge in managing suicide? Anyone be willing and open to share about it? Oh, so a bit of quietness. So Brian, can you just share a bit your experience of managing suicide? That has been your biggest challenge, Brian, when managing suicide.
Sorry, you are asking me?
Yeah.
Uh, I think it's to really get to the bottom of what is really causing them to have suicidal thoughts. Often we just look at suicide at face value, but we also need to know that it's really sometimes their solution to some problems that they cannot overcome.
Mm.
And I think it's really to understand exactly what is the reasons that they are thinking of suicide. Yeah, that would be my biggest challenge. Thanks.
Mm. Thank you for sharing, Brian. So I think I do agree with you. A lot of times suicide, we take it at face value and we take it as a response, but there's always an underlying thing, something driving the suicide. And I think we want to talk about that today also, to explore what are these drivers and what would be causing a young child to kind of think about ending their life. So, like Alex touched on earlier, it's a very big problem. And I think we recognize that suicide is the leading cause of death among people 10 to 21, 29. It's a very large group of kids who are actually experiencing suicidal thoughts. And I think in TinkerFriend, so TinkerFriend is one of our internal services, which is a hotline for primary school kids primarily, so P1 to P6. And TinkerFriend actually has seen a twofold increase of kids expressing suicidal and self-harm intent. So when we talk about twofold increase, it's really a 300%, 200, 300% increase in number of kids who are calling in to TinkerFriend saying, I want to hurt myself, I want to kill myself. I think that's something that's really very triggering, or very concerning for us at Children's Society also, when we hear this stats coming out. So understanding suicide risks, we need to look at it as a wicked problem. So when we think about problems, we also need to think how can we solve this social issue. So by looking at it as a wicked problem, it's a very highly complex issue, and there's no single perfect solution. So coming into this session also, I'm not here to give you a one size fits all perfect solution to how to manage suicide risk with kids, with twins, because there's no such thing as a perfect solution in suicide risk. And it requires a whole of society effort. Because like what Alex was sharing, it's everyone's problem. It's everyone's business. And when we come of it, when we look at it as a wicked problem, we also recognize that addressing suicidal risk with one individual may be different from addressing suicidal risk with the second individual or the third individual. And addressing suicidal risk at an individual level and kind of personalizing the support for the individual is important when we think about suicidal support. I think that's something that we want to advocate for and we want to recognize also. It's not a just do these things or practice these skills and everything will be okay, but every person needs an individualized support. So moving back. So we want to think about what's driving a lot of suicidal risk for teens or tweens. So the trend that we're seeing is that there's a decline in traditional ideals of a stable environment at home. So we're seeing a lot of differences in family interactions, differences in parental behaviors, in parental interactions, and differences in child behaviors. This kind of driving a lot of the increase in suicidal behaviors. So something that we've noticed also is increase in social media use. So what we know we hear from kids, or what I've heard from a lot of the cases that I work on, is that youth will kind of create their own space, online space, which reinforces suicidal behaviors or suicide intent as normalized. So it's very prevalent now. So, and because the algorithm runs that way, if they interact with mental health content, they interact with suicide content online or self-harm content online, it will keep feeding them the same content over and over. So we also have seen that uptick in the algorithm picking up and use reinforcing the content internally. So a lot of the youth that I've worked with in Flourishing Minds, when we talk to them about their social media use, what they're doing online, and all that, they do bring up, oh, I'm watching a lot of TikToks, I'm watching a lot of online content, talking which has uh intent or conversations about self-harm or suicide. And that kind of makes them think more about it, but it doesn't instigate or doesn't make them want to do it. So it's kind of balancing it out for them, or just trying to understand what's going on for themselves in their own social media use. So I think want to caution also, social media use on its own is not a drive. It's not causing suicide ideation, but the increase in social media use also isolates them from people, which then reduces their social support and then causes them to feel more lonely, and that will increase their suicide risk. Then what we also seen is a lot of youths have increased body shape concerns. So a lot of the females that we work with in Flourishing Minds, they do express that they self-harm or they have suicide intent because of how people have commented about their bodies. And they feel that, oh, I don't fit in, I'm not good enough, I'm not nice enough, I'm not pretty enough. And then they go into that space of trying to withdraw, trying to isolate themselves. And then that does increase their desire to self-harm and to consider suicide as an option. So then that social connection becomes more important than what we've seen in tweens, which does drive a lot of the suicidal behavior that we've seen at FM Lab, at Flourishing Minds. And one of the last things that we've seen is cyberbullying. So 1 in 5 youth actually just do express increase in cyberbullying or increase in people kind of negative comments online, negative perceptions online, perpetuating their own suicidal ideation or their own thoughts of I'm not good enough, I'm the worthlessness, the hopelessness. And that drives a lot of their thoughts behind I want to leave. I want to end my life, or I want to just never wake up, I want to disappear. So what you see is a lot of these trends have been picking up in the recent years. And it's really something that we've noticed more prominently recently. With the conversations, we brought it up with the youth that we work with, the children that we work with, that these are the things that have been causing them more distress, which then lead to more suicide ideation or self-harm behaviors. So a lot of times when you look at the current solutions that we have for suicide risk management and suicide containment, it's really most individuals who attempt suicide move from ideation to behaviors within a very short time span. Research has shown that it can be as short as a few seconds. So the idea pops into their head, I want to die, I want to end my life. And within a few seconds, they move to active behaviors. Or it can be dragged out to a few hours. So they ruminate on the idea for hours on end, and then eventually say, this is what I want to do. And the behavior pops up. So because there's so much variation in how suicidal behaviors show up in tweens, then there's no perfect indicators that we can look for that someone is thinking about suicide. But there are certain factors that we can consider and we can identify to help us know that the probability that someone is thinking about suicide, or the probability that someone is more likely to kind of go down the suicide ideation behaviors. So the current status quo that we look at is really restricting access to means. So because we don't know when someone is going to be pushed to a suicidal behavior from ideation, the best route that we use now is really access restriction, preventing someone from getting access to high-rise buildings, to medication, to sharp objects. So that's where we kind of put in the brakes for suicide solutions at this point lah. But are these solutions sufficient? That's also in for research to come back But I think what we've seen in the trends also is that people who are really, really intent on ending their lives will find a way around the restrictions. So then how can we better support them and better identify and step in to effectively support or reduce the risk of them attempting suicide? So what we've recognized is suicide would serve a function. And this is really the CBT concept of behavioral analysis, which is we need to understand what's the function of suicide for the individual and where the individualized support comes in. Because a lot of times when we talk about suicide, we're thinking about, oh, this is just an action. This is just a behavior. I just need to stop them from trying to kill themselves. But if we dig deeper, we need to understand what's the primary function and what Brian talked about earlier, what shared about earlier. We need to know what exactly is driving them towards suicide. Are they trying to escape something? That's why suicide becomes the option. There's that external social environment that they're trying to run away from, and they feel that ending their life or disappearing is the option that they are taking up. Or they're trying to feel something. So some people, some of the kids that I've worked with, they express they don't really want to end their life, but they say I tried suicide or I tried to attempt suicide or self-harm myself because I felt nothing. So the distress caused by the isolation, by the emptiness, by the hopelessness is what drove them to suicide. And they're trying to avoid that and to feel something. That's what drove them to a suicidal state. Then suddenly there's also the aspect of reducing tension because they couldn't tolerate distress anymore. They couldn't tolerate the arguments or the disagreements at home or some form of interpersonal conflict or some form of internal conflict. And they said, okay, maybe the only way to solve this problem is to end my life. So once we can uncover and explore with the twin or the child what's really behind the suicidal intent and the suicidal behavior, we are better placed to understand how best can we support this child. And then we address the intent or address the concern underlying the behavior rather than just the suicidal behavior itself. So we're moving away from just restricting access. I'm trying to stop you from hurting yourself to I'm trying to help you move beyond what you're going through, help you work through your distress or work through the struggle you have or work through the conflicts you're experiencing with yourself. And that also helps the individual, the child, feel that they are being heard, they're being understood, and they're able to connect better with us. And that also helps to reduce that desire to end their life or build some hope for the child. I think that's the main thing that we look for when we work with tweens who have suicide ideation, with building hope. Helping them recognize that suicide is not necessarily the answer or the solution that they're looking for. So building on what I was sharing earlier, often what I've heard in my cases or some of my cases which have very high suicide risk or very perpetual suicide risk, they do tell me they don't want to die. Explicitly, when I ask them, do you want to die? They say no. But when I ask them, what is it that drives you to want to kill yourself or want to hurt yourself, it's really this desperate desire to escape pain. And this pain that they're talking about is really, it can come in many forms. So some of my clients have shared the pain is about loneliness. They feel social isolation. They feel that no one understands them. No one cares about them, or their family is dismissive, or their friends are dismissive, and they feel that the only way I can end this pain is if I kill myself. Some of them they do express that the reason why they consider suicide is because they are afraid of failure and humiliation. So when I ask them what's going on, they say, "Oh, my friends make fun of me," or "My parents would scold me for failing my exam." And to avoid that pain or that fear, to avoid that punishment, they say, "Oh, if I kill myself, I don't have to deal with it." So recognizing this, we also then shift our perspective away from suicide as this genuine desire to end their life, because most of the kids that I work with don't actually want to die. What they want is someone to kind of recognize and acknowledge that pain and kind of validate that subjective pain that they may be experiencing. So once we are able to recognize and validate and kind of reflect that pain to them, then they come out of that state of suicide as the only means of solution. So then a key aspect of the work or key aspect of working with tweens who experience suicide ideation is really holding space for their psychological pain. So something I've heard a lot from the kids I worked with, when I ask them, what stopped you from telling your parents about your suicide ideation? is I'm afraid of how my parents will react. So parents, well, the parents I've worked with, they care a lot about the kid, but the kid feels that the parent will overreact, will get upset with them, will start scolding them if the kid tells the parent about their pain. Or the kid feels perceives it that the parent will be dismissive. The parent won't understand why I'm feeling this way, why I feel lonely, or why I feel humiliated. And then my parent might kind of dismiss me or try to tell me, oh, it's okay. And that makes the child I work with feel invalidated. And that's where they come in and tell me, that's why I don't tell my parents about what I'm feeling. That's why I don't tell my parents about my suicide ideation or my self-harm behaviors, because my parents are, I'm scared of how my parents will react. So us as adults have to have the capacity to hold space for the child's psychological pain. And I think that's a very big ask for us also lah. I recognize that watching a child be in pain and in distress is not an easy thing. So then for us, we need to kind of think back and reflect and kind of regulate ourselves. So as a child expresses their suicide ideation to us, expresses their psychological pain to us, we need to be able to manage our own reactions so that the child doesn't feel that they are overwhelming us. So fundamentally, what drives a lot of the children, the suicide ideation for the children that I work with so far is the child feels trapped in this psychological pain, and suicide becomes the only solution out of pain for them. So the child hopes for the pain to stop permanently, and they see that they've tried, most of the time, most of the kids I've worked with, they tried multiple things to stop the pain. They've tried talking to adults, they tried talking to their friends, and they tried different things to try and stop the pain already. And eventually they come to the point where I just want the pain to stop. And that's when the suicide ideation kicks in. The self-harm behaviors kick in. They tell themselves, maybe the only way for me to stop the pain permanently is to kill myself. So it really stems back to this desire of trying to escape pain and trying to escape this distress that they're in. So, and a large part of that is that some kids also express a desire to regain control over their environment. So, some of the kids I work with have experienced a lot of traumatic or adverse events in their childhood. And when they express suicide to me, they say, because I have no control over people around me, I have no control over what I can do, what I can say, who I can meet, and choosing how I die is the only thing I have control over. And that's generally the expression when I work, some of the twins I work with. So when I talk to them about this control and this relief that they're seeking, it's really understanding that working is then shifting to the perspective of what other things are within your control. Is death the only thing that you can use within your control? Or are there things that you can explore that's more within your control? Things like your school or things like your daily activities. And I slowly shift and expand the perspective in terms of control. So a lot of the twins that I work with who have expressed suicide ideation also is really helping them see that suicide is not a solution, but it's a displacement of the problem. Because when I talk to them about suicide as being a solution, they always say, yeah, if I end my life, then I don't have to deal with this anymore. And I explore with them, then if you're not dealing with the problem, who else deals with the problem? Because the problem doesn't go away. And that helps to shift their perspective towards recognizing that their death is just causing pain to people around them. So that's some of the conversations I've had with some of my clients who have expressed suicide ideation lah. So coming back to some more practical aspects of how we can support twins experiencing suicide, we can ask about the quality and intensity of the child's pain. So when we recognize that suicide is a response to psychological and emotional pain, by helping the child express and kind of validate and understand their own pain, we can give the child language to express themselves a bit better. And then we can start working through with the child. What does this pain mean for you? Where is this pain coming from? And how can we reduce the intensity or the quality of that pain? So then it's about this differentiating the intensity from dysregulation. So what do I mean by this? So a child may actually express suicidal thoughts with very high intensity, but be perfectly regulated, be very calm about it. So I've had clients who have perpetual passive suicide ideation. Like every day, if I ask them, do you have suicidal thoughts? They say yes. What's the intensity on a scale of 1 to 10? They say 10. But they are perfectly regulated. They're not crying, they're not upset, they're not angry. They're perfectly calm when they talk to me. And then when I ask them, when I have this question, or I have this conversation with them, what's stopping you from attempting suicide? They say most of the time is control. Is I still have things that I want to have control over, so I still have some hope in my life. And if they lose that hope, that's when they remain regulated, but they will attempt. The behaviors kick in. So then differentiating the intensity from this regulation and saying and recognizing that a child may be perfectly regulated and perfectly cognitive and be aware that their suicidal behavior is something that they want to do, but have no issue and be intense suicidal thoughts are present and have no distress from the suicidal thoughts. So then we need to watch out or be more aware of what's going to trigger them to go into a suicidal state, whereby the pain becomes too extreme or they lose control and lose hope. So something else that we can do as adults is really name the pain. So like I spoke about earlier, by identifying and helping the child validate and name what's going on, the child is able to express themselves and regain a sense of hope and control over the situation, which then helps them feel that maybe suicide is not the only solution. Maybe it's not the only answer they can look for. And then expanding that perspective for them does open up pathways for us to involve other people to support the child. So one thing that works for me is that when I've allowed my client to kind of recognize, name what exactly is making her feel suicidal, primarily like if it's friendship issues or conflicts with peers and all that. And she said, yeah, because I was frustrated with my friend and I argued. That's why I feel I want to kill myself. When she was able to name it, and she said, "This is why I want to kill myself." And I said, "Do you have other people that you have that care about you, which you want to maintain that relationship with?" That opened up her perspective or her willingness to kind of engage and move beyond that one singular event which was causing her pain. And then finally, normalizing the wish to escape. So we can always tell a child it's okay to want the pain to end, but that doesn't mean that suicide is the only solution. So saying that to a child, telling them that it's okay for you to want the pain to end, for you to want a solution, without saying that suicide is the only solution, is kind of helps the child recognize maybe there are other ways. Maybe this is how I feel now, but it's not always how I feel. It won't always be how I feel in the future. And then helping the child move towards that hopefulness that, okay, maybe I can move past this pain will help the child kind of consolidate their own emotions and re-engage with you. So I think wrapping up, or in terms of how children desire that sense to how to we can kind of reduce children's desire for suicide as the only solution to their problems. What the children I work with fundamentally desire is a sense of connection and belonging. So a lot of the kids that I've worked with, what drives or what they want or what they seek when they tell me about their suicide ideation is really they want someone to care. They want someone to sit with them in their pain and validate the pain that they're feeling and validate what they're going through. And not just give solutions. So I think that's something that we as adults need to recognize and need to be considerate of and cognizant of, which is the first step is really connecting with the child. Helping the child feel that, yes, I see your pain, I see you're in pain, and I see that you need support. So moving on then is what supports the child is really participation activities that develop their sense of purpose and belief, building hope for the child, building worth for the child. So as the child moves beyond that, this is the only thing I feel, and we expand that emotions, expand that sense of hope. They feel that, okay, I can move forward and things can get better. So by engaging the child in purposeful activities, in purposeful beliefs, and show them that what they do, that small steps that they're making to kind of come out of the pain does have purpose and effect. And then highlighting it to it very, very clearly and very, very being upfront with the child would then help the child recognize, yes, what I'm doing is helpful. What I'm doing is hopeful. And then finally, providing children with knowledge and options to make an informed choice. So like what I've done with tweens is really, I tell them suicide is not the only option. There are other options and I explore with them different options that are available. I don't necessarily take suicide off the table, because some teens feel suicide and they die want to have suicide as an option. But we do have to expand the perspective that maybe suicide is not the best option. Providing them different options, providing them explicitly providing them that options of, okay, what's the consequences of this behavior? What's going to happen if you attempt? What's going to happen if you try engaging with your parents? What's going to happen if you try engaging with your friends? What's going to happen if you try moving towards something more purposeful or belief or supportive and hopeful? And then by having those deeper conversations about the consequences and the options, and then asking them what's their preference, the child feels more supported, and the child will feel that, yes, I have more control. So this then goes back to the earlier statement I made, because a lot of times when children express that I want to kill myself, I want to commit suicide, they want control. So by giving that option, by expanding the perspectives, expanding that choice, and then giving the child back the control, we kind of help the child recognize that so that there's more ways than one for them to experience control and experience choice, which then reduces their own suicidal belief or their own suicidal behaviors, their own thoughts that, oh, suicide is the best way for me to exert my control and exert what I want. So can this look like in terms of practice? It's about acknowledging that life is a process. So acknowledging and recognizing, having that conversation with a child to say, yes, I recognize you're in pain now, but the pain will not last. The pain is not forever. It's not permanent. And you're going to experience pain in the future also. So then how can we support you as you experience growth and challenges and pains as you move along in life? So then it goes to supporting the child, identifying things that are worthwhile, hope for the future, things that are meaningful and life-giving for the child. So I think this is a conversation that we've had with multiple parties also, and we've all come to the same conclusion, which is a lot of kids nowadays, they express a lot of nihilism, a lot of hopelessness to the future with everything that's going on. So then supporting a child to kind of identify what can they look forward to. It can be something as simple as looking forward to the weekend with your friend, or it can be something as simple as looking forward to spending time with your pets. So I think just the small things that we can identify with the child can help them just build that small step towards a hopefulness for the future. Then recognizing as adults, we don't need to solve every problem. So I think this is something that a lot of the younger teenagers that I worked with have told me also. They go and talk to their parents, they tell their parents what's going on, they express the socialization, the parents come in and say, oh, I need to solve the problem for you. And the kid genuinely did not want the parent to try to solve the problem. All the child wanted was for the parent to listen. So it's just a recent case also. I was talking to a child, and the child had a fairly good relationship with her mom. And she would tell her mom everything is going on and stuff like that. And mom would always say, oh, you need to do this, you need to do this, you need to do this. And the child would just argue back with the mom. And then that would trigger the child's suicide ideation. And then when I worked it out with the child, when I talked to the child about it, what made you want to end your life? Like just and the child said, because my mom kept telling me what to do and she wouldn't listen to me. So when I asked this particular child what would have been helpful for her, she told me, I just wanted my mom to listen and just keep quiet. And I think that's something that when the mom was in the room when I had this conversation with the child, and something that the mom also was taken aback by. Because the mom thought that by solving the child's problem, the mom was helping her. But for the child, it really felt the mom was invalidating her and making her feel like she couldn't do anything. Which then made the child feel that, well, if you feel that I'm so pointless, it's like I can't do anything myself, then what's the point of me living? So it's not that parents don't care, it's not that the child doesn't care about the parent, but how the child interpreted what mom was doing was really so negatively that it caused the child to feel suicidal. And all the child really needed was mom to validate her. So then we want to encourage the child to share, which goes back to what I was saying. The mom really, when I had this conversation with the child and the mom, when I asked the mom, okay, what's going to stop you from encouraging her and to validating her? The mom said it's just her own emotions. So when I did the session with the family, the mom and child, it's really just talking to them about, okay, how can mom encourage the child to share? What can mom say to the child to kind of make her feel validated, to make her feel that, okay, whatever you say is safe. And finally, part of this was supporting mom to be exaggeratedly positive. So what this looked like, because I think for the mom also, it was really, mom was very social focused, very problem focused. When the child comes talk to her, the mom was always going to, oh, your friend is like this, you need to do this, you need to do this, you need to do this. And the child really felt overwhelmed because mom only saw problems. And that made the child feel that, oh my goodness, there's nothing I can do. So when I coached mom to be, okay, how about you try to elicit out what are the strengths that you see in the child when she comes to you with what she's going on, what's the problem that she's facing, and be very positive about it. It was a challenge for mom, I admit. Mom also expressed that it was a challenge for her to be explicit and more focused on the positives that the child is seeking support. But as mom practiced it more, she became more comfortable. And the child also became more comfortable expressing when she has suicide ideation, when self-harm thoughts to mom. So as that progressed on, then it also helped the child to recognize maybe suicide is not the best option. Maybe self-harm is not the best option. And the child became more regulated and more able to kind of, okay, to recognize that her problems do not need to end or do not be solved by suicide. There are more that going to mom, maybe mom's solutions can work, but just mom needs to regulate herself before she uses solutions. So with that, that's the end of my sharing. So then it's for my the final takeaway for me is really when we talk to tweens about suicide, it's really first we need to regulate ourselves. So we as adults cannot react to the child's expression of suicide ideation or self-harm. Even though it is very distressing for us, we need to recognize our own distress and then tolerate our distress first. So then we can then relate and engage with the child to validate their feelings, to encourage them to share with us about what's going on. And then we can support them in identifying things that are worthwhile, life-giving and hopeful for the future. So then as we identify and we support and encourage them to express themselves, their own distress will reduce, and their suicide ideation will slowly become more manageable, and the self-harm behaviors will become more manageable. But I think the first step is really us as adults creating space for children to express their own inner thoughts, their own suicidal thoughts or their self-harm thoughts, and then normalizing that it's okay to want the pain to end. Normalizing that it's okay to feel distress. It's okay to feel emotional pain as you grow up, as you face challenges in life. But then expanding the perspective, expanding the options to how we can manage that psychological pain, that emotional pain with each other and together as a community is more effective to supporting a child experiencing suicide ideation beyond just restricting access. So with that, am I sharing? And over time to Brian. Thank you.
Okay, thanks, Alvin. You can hear me? Can okay. So my name is Brian. I'm going to share my slides. Wait, slideshow. Okay, can see my slides, right? Okay, so my name is Brian. I'm a clinical psychologist working in IMH. So to be more specific, I actually work with children and adolescents lah. And in fact, mainly adolescents who are suffering from mental health disorders like anxiety and depression. So that's the main part of the work I do. So I've been working there for I think more than 15 years. And sadly, the numbers seems to be increasing. Um, and we see more and more teenagers, feeling very stressed, getting depressed or feeling anxious. And suicide is one of the symptoms that we see in this population as well. So as Alvin has went through twin suicide, I will talk more about teens suicide, which is the older age group, but they can overlap. There isn't a clear line where twins and teens suddenly they become another person. So they are similar, but of course they have a slightly different way of thinking as they get older. They can be a bit more mature yet still immature in a certain way. Okay, so today's my talk is about teen suicide, breaking silence and building hope. So this is the content I will talk about understanding youth suicide, some of which might overlap with Alvin's sharing. Okay, practical intervention strategies and how do we support parents and caregivers, and then finally some resources. Okay, so why are we here? I think Alvin has mentioned suicide is the leading cause of death for many teens in many countries. And in Singapore, it is the leading cause of death for our young population. And many young people struggle silently. So having these open conversations can save their lives. So everyone in this room, I believe you could be a parent, a teacher, healthcare professional, you work in the social service, or you could be a family member or neighbor or someone young, right? And potentially maybe listening to this talk and understanding more about suicide for youth can help you save a person's life, right? We'll never know when we use the skills that we learn. Um, so some ground rules first before we start. As mentioned, we are talking about contents or suicide. I might use some examples from my own case, but I will not name the patient. But maybe it's just a presentation that I've seen. So do keep it confidential. Uh, and it's quite emotional content. So we try to listen without judgment. At any point of time, do you feel very unwell, uneasy, or uncomfortable? Please know that there's resources, there's My Line, there's 1771 that you can call. And of course, in this conference, there's facilitators from CFL. So you can, I think, message them directly, right? They can put you in another room and try to help you if you're feeling unwell. Okay, so let's carry on. I want to ask about misconception and myth, and I want to clarify those myths because I think there's a lot of misunderstanding about suicide. So maybe to make it more interactive, right? Can you put it in a group chat? What do you think are the main myth or misconception you have about youth suicide? You can give you a few minutes to type in. What do you think is the main misconception? Oh, did I stop share? All right. About youth suicide. Look at attention. Nobody understand them. Okay, I see a lot of attention seeking, defeated. Okay. So when they are suicidal means they are defeated. Copy, peer pressure, worthlessness. Talking about suicide or plant the idea. Yes, Alvin. Couldn't cope with life, expectation, cannot share my views. Uh, Not resilient, get defeated easily, unable to express well, impulsiveness, hopelessness, more fragile, right? Every generation, new generation is more fragile than the others, right? That's what we always think. Trauma, depression, yep, stressful family situation. Okay, cyber addiction, no one can hear strawberry. So this, I think, is the same as the fragile generation kind of thing. No other way out of the problems. Lack self-confidence. It's a crime, okay? Don't understand. All right. Okay, thank you. I think there's a lot of good points there. Where somehow my screen is very weird now. Okay, don't have a choice. Right. Okay, with faith, don't take suicide. Okay, don't have options, social media exposure. Right. So let's go on. So as mentioned, right, the first misconception is that they are attention seeking. Right. No, they're saying that to get attention. And this is actually quite dangerous because I think when someone talk about suicide, right, I don't think they are just seeking attention. They are really seeking for help. So even if they are attention seeking, right, we must ask ourselves, why does this young person feels the need to, go to such extreme to be heard? And I think research has shown that 50 to 80% of people who attempted suicide have actually given some warning of their intent, right? So with that, I think is important for us to know that if someone is expressing suicide, we try not to take it as this person is just attention seeking, right? It could have been multiple of such things when this person keep on saying, and then the boy who cried wolf. After a while, we think that, yeah, this person only say only, right? Not real, not no, it's not a real attempt. Sad to say, in my practice, right, we do have such cases where they have expressed many times, and the parents also start to be complacent, right? And we think that maybe it's just say only, right? But it just take one time of that suicidal attempt, successful attempt, and that's it. So I would encourage everyone to please take all the uh you know every time any child or any youth talk about suicide, we try not to take it like, oh, it's just attention seeking, right? No matter how many times they have done it before. Okay. Next misconception is that this is very common. Some teachers, parents say, hey, we better don't talk about suicide. If they don't have that idea, you say already, then they suddenly have that idea. Um, the truth is that these conversations occurs in social media in many different places lah. So talking about it doesn't trigger suicidal thoughts. In fact, it actually reduces risk, right? The evidence show that is the opposite is true. If we have open, honest conversation, it actually quite reduce the risk. Okay, and if we avoid the topic, right, we actually reinforce this shame and isolation that we cannot talk about suicide. Okay, so think of it in this way: when you talk about suicide, right, it actually creates path to help, support, and healing, right, rather than making the person have the seats, right? Teachers talk about, wait, let me see this. I like that it's quite interactive. People can put in the chat, right? Yeah, talking about suicide, of course, copycat case. Uh, I think the truth is that if the child is well, right, normally even if they hear about it, they wouldn't harbor that thought, lah, right? It's because, as what Alvin said, they already have existing pain and suffering that and the struggle that they have, and probably hearing about it, is just part of them trying to get out of their struggle. Okay, so but for well-adjusted, functional youth, I don't think that talking about it make them want to do it, right? If their life is fine. Okay. It happens without warning. Some people will say that it's very sudden, suddenly this person wants to die. But if you know the child well enough or the youth well enough, it actually comes with warning. Okay. It could be the changes in the mood, behaviors, or the way they talk. It could be the way they withdraw, right? Or it could be they have sudden mood improvement. That's something that's quite surprising, right? Mood improvements. I thought that when they are unwell, their mood is bad. But the mood improvement come from this idea that, hey, I found a solution. So when I found a solution, I feel happy. But the solution is the maladaptive solution of suicide. Okay. Uh, Another thing that we need to take note are previous suicidal attempts, right? These are things that increases the risk if they have tried before. Okay. There's also indirect and indirect statements about death lah. So it's important to recognize these statements. Okay. Uh, I think later I will talk about these statements. Okay. Without warning. Okay. Misconception for I think someone mentioned depression, stress. So it's true that depression increases the risk of suicide, but not the teens that with mental illness are not the only one at risk. Okay, there are people without depression. Okay, but they can face certain stressors, bullying, academic pressure, family conflict, okay, relationship problems, identity struggle. They can also have suicidal thoughts. Okay, question from MHC. Are those determined? Good question. Are those determined about suicide hide their intentions and plans? Okay, this is a very good question, and I think that usually suicidal thoughts are not so pure and not so people are really ambivalent most of the time, right? They want to die, but yet they want to live. So those who hide and pretend, right? Of course, they are very, very determined to do so, and increases the risk of them succeeding. But most of the time, people do are in two minds about this thing. So they might want to die, but they will share. That's the part where we don't want to say that they're attention seeking, right? And they will sometimes talk about it, right? And usually when they want to die, they have certain warning signs, right? Which I will talk more about later, right? Um, Those that hide, right? Yes, it can happen, but even the cases I see, some of whom are quite determined, right? They also still reveal some of this suicidal ideation, right? I think those who purely hide, of course, it's very hard to find out. If the parents are very close, they can sense something different. Whether is it the way they talk, the way they behave, the withdrawn behaviors, is it can be quite obvious to parents that something has changed. Okay. Okay, let's move on. Once suicidal, always suicidal. So this is quite a harmful misconception of myth, because it removes hope. It's as though like it's a terminal illness. Once you have it, you will always have it. I think with proper support, proper treatment, is very much possible to have recovery and hope, right? Many people will experience suicidal thoughts, go on to live a full, meaningful lives. So it's really possible to recover. In fact, it's very common to recover. That's why immediate support during the crisis period is very, very important. Okay. And we want to have hope. I think Alvin talked about how suicidal ideations are because of pain, right? I also think that it's also because of lack of hope. It's usually a combination of too much pain, too little hope, right? And of course, there's other factors like the agitation, the suffering, the self-hate. Some of them self-hate. Yeah. Recovery means uh, recovery means that they are living a functional and meaningful life without thinking about suicide uh, as a solution to their problems, right? And go on to solve their problems. Okay, so that's misconception 5. Okay, so these are the truths that saves life. Every threat needs attention. We don't take them as just attention seeking. We hope to have open conversations. Warning signs exist. There's also multiple signs that exist, right, that we can see, which I will talk about later. Multiple risk factors and recovery is possible. Okay. I like that it's quite interactive. People ask questions and I can try to answer also. Okay, so next, understanding youth suicide is quite important because we want to know what are the things that led them to feel pain and suffering and stress lah. Uh, I think Alvin talked about how suicide is the solution. I think that's really a very elegant way of putting it. Often we see patients, right? They come here and then we ask parents, so what's the main concern? Parents say they are suicidal, right? So the problem is suicide. But if I turn this around, suicide is not the problem. Suicide is the solution. What exactly is the problem that leads them to use this very maladaptive solution of suicide to solve, right? Is the problem perceived as insurmountable? Are the problems causing them daily pain and stress and suffering? Are the problems apparently hopeless to them? And in that situation where they are so hopeless, so pain, and they could hate themselves, they could hate their life so much, suicide does seems like a viable route, viable solution out of this pain and suffering. Uh, so if we, instead of taking suicide as the problem that they want to die, I think the problem is that they don't want to live a painful life. So the solution is really, other than suicide, we need to point out to them, how do we solve the problem? How do we have a better life, right? Despite the problem seemingly so difficult. Uh, we can talk more about the problems. Why is it so, insurmountable? Why is it so difficult? Okay, academic pressure is something that's very common. If you look at our system, right, education system, we are trying to make it less competitive, right? For example, PSLE, no more T score, we have an AL score. No have exams for lower primary school, right? We don't release the ranking anymore of secondary schools or JC. We try to say that every school is a good school. But sadly, people still know that there's certain levels to schools. Some schools are more elite, right? And this competitive school environment is also within the school. There's good class, not so good class. There's express, normal acad. normal technical. No, I know now they have a new system where you can take subjects based, right? Which is a great change, right? And also within the school, sometimes teacher have their own expectations, classmates compete against each other. At home, parents have the expectations. And most importantly, they have their own expectations as well, right? These are all internalized expectations. The ideas of meritocracy is that if I do well, I can get into a better, next step, better school, get a good degree, get a good job. But if conversely, if I don't do well, I can't get into a good school, I can't do well, can't get a good job, maybe it's the end of my life. So there's these high stakes examinations as well, A levels, O levels, that can be quite scary, right? 4 years of study accumulating to one exam, right? And it's almost feels like it's a make it or break it kind of thing. If I don't do well, that's the end of my life. And some of our youth do struggle a lot with studies. Okay, they could also have some issues with learning difficulties, or they could have depression, and this leads to school being a very high pressure environment. And when they couldn't see a way out, right, everyone is in school, I can't get out of this, uh then the only way is to kill themselves. I always like to tell my patient, if you miss the train, what do? You take the next one, right? But sometimes people can't see that actually there's a next train. If you can't do the exams this year, do it next year, right? If you can't do this exam, then maybe see what you want to do with your life. There's always way out. And once you allow them to think of options, maybe the suicidal thoughts can come down, right? Because they are stuck. So we need to help them realize that there's different pathways to life, there's different routes that leads to Rome. And success could be understood in different ways, and it's up to them how they want to create their own future. Okay, that will help. All right, let's move on. Okay, friendship is also a big part. Okay, let me read the comments. Yeah, sometimes teens use blackmail, emotional blackmail. Oh, sure. I can give an example. I saw one teen who was so um afraid of school that he threatened to jump down the MRT every time parents force this patient to go to school. So in the end, yeah. So in the end, what happened is that they actually allowed the patient not to go to school for many years. But eventually, what happens is that came for therapy, and we talk about the desired future, and the patient actually took private, I think O levels, and managed to do well enough to get to the next stage of life. Yeah. So yes. So that's that. Um, okay, then but in school, other than academic, right, there's always friendship conflicts, peer rejection, bullying, relationship breakup, sexual orientation, identity problems. This is something that is quite new nowadays, and social media pressure. So there's different levels of friendship issues. Bullying can be very painful and traumatic, right? And it has to be intervened. And this is a recent thing that we see more and more bullying cases. And actually, it's not recent thing. I think it exists all the time. It's just that with social media, it can lead to a even more widespread kind of bullying, right? And it can be even more intense, right? So so it's important to intervene, right? All these issues. Friendship problems can be quite hard to intervene, especially when they're older. You can't do anything. Sometimes it's about understanding how they can move on from certain friendships that cannot be repaired and finding new friends. Yeah. Okay. So you have teens to attempt suicide in your support group. I read that there are voices in their minds to try to. Yeah. There's sometimes they do have psychosis, or they start to have hallucinations. Uh, so they will call it, I hear voices, but a lot of times these voices are projection of their own inner consciousness lah, that they want to kill themselves, right? So it becomes like a voice. Okay, so let's move on. Family dynamics is also a big part, other than school, academics, friendship at home, when there's family conflict, family violence, abuse, divorce, separation, or the family environment can be high pressured. Uh, it's really is really something that can cause the teen to you know buckle and thought of ending their life, okay, or lack of understanding or support. Family history of suicide or mental illness create this idea that maybe it's something that can be used to solve their problems. Okay, so family dynamics is also another risk factor. Okay, so digital age challenges, we talk about the different pressures from digital life. Cyberbullying is quite can be very pervasive, right? If you think about bullying physically in school, maybe you come home, that's it. No, maybe the bullying stopped. But cyberbullying goes on and on and on. Nowadays, teens are stuck to their devices and imagine that they can see all the comments or all the negativity that keeps coming in, right? It seems like there's no escape from the bullying even at home, right? Social media comparison, have this pressure to be perfect, online harassment, digital addictions, can disrupt sleep and affect their mental health. Uh, FOMO, fear of missing out, creates this anxiety, right, about being, miss out, left out, or missing opportunities. So this can make them feel very stressed about life as well. Okay, let me read the messages. Do we have teens? Okay, yeah, using emotional blackmail. How do you know if it's blackmail or real? Right. So I think even if it's not real, right, there must be something that they're struggling with that they have to resort to the emotional blackmail, right? So what exactly about that thing that they want to avoid that causes them to resort to that? I think that's the more important point. Like, what are they struggling with, right? Uh, I think we try not to look at the surface, whether it's emotional blackmail or suicide. They are really like the tip of the iceberg. If we can look down into the iceberg, what exactly is causing them to engage in these behaviors? Okay, slides, email. I think this one need to ask the organizer, but I don't mind sending the slides. Um, okay, let me see. Are they able to handle cyberbullying with so much cyber wellness? Hopefully, the cyber wellness program can help. Okay, all right, let's move on. Mental health challenges. I think I talked about mental health conditions that increase the risk factors of suicide, like depression, anxiety, trauma, low self-esteem. Substance use is a new thing now. No, now we have vaping, etomidate. These are things that actually changes how their brain, think and can be quite dangerous. And of course, difficulty in managing their difficult emotions, like anger, sadness, anxiety. All right. Some risk factors in the environment that increases their risk of suicide, like access. I think Alvin has mentioned, right, one of the important ways to stop them from suicide is to prevent access. Window grills, medication, detergents, sharps, ropes. So these are dangerous things that could they use to commit suicide. And if we can limit the access, it actually reduces the risk. Okay, exposure to suicide in the media, especially those negative social media that encourages suicide, right, can be quite dangerous. Lack of mental health resources, stigma of seeking help. There are some cultural beliefs or some family beliefs that maybe seeking help is very shameful. You shouldn't seek help for mental health issues. So there could be these barriers. Okay, and of course, crisis points like major life changes, major exams, personal failures, losses of family members could lead to increase in the risk factor. Okay, understanding the warning signs. There's actually many warning signs, like as mentioned, right? That our youth shows when they start having these suicidal thoughts. Let's go through them one by one. Verbal warning signs are very can be very obvious, but can also be quite subtle. Okay, very obvious, I want to die, I don't want to live anymore. Subtle ones will be like, no, it's better that I don't wake up. It's okay if the car bang me, everyone will be better off without me. This can be less obvious, right? So we need to take uh, warnings like that seriously. Okay, so even very casual reference to death, we should give attention lah, and not dismiss these statements as attention seeking. I think if people start talking about this, they desperately need help, and we can sit down and listen, right? It'll be very helpful. Behavioral changes, again, giving away things, uh, goodbye notes, right? Sometimes they write something in social media, uh, or suddenly mood is very good, right? Or if you know that they're researching on methods, or basically making final arrangement, giving things away can be signs that they are trying to end their life, and we have to take this seriously. Okay, academic and social science are really like functioning decline. Grades suddenly very bad. Oh, don't want to go school, don't want to meet friends, loss of interest, don't want to participate in activities that they used to like. This could be a sign of depression as well, right? Losing motivation, low mood, right? Loss of interest. So these are signs that we need to take seriously. Okay, academic, social science, emotional indicators. Mood swings, persistent sadness, hopelessness, or that's the low energy kind, but there's the high energy kind, very irritable, very angry, very frustrated, very extreme mood swings, and then talk about worthlessness or guilt and shame. Okay, these are also clear emotional signs. Sometimes they might mask these feelings around adults, but present to peers or present to people that they are comfortable with, and sometimes peers might also share this, like to teachers as well, right? So physical signs are things like sleep pattern changes, appetite pattern changes. You don't sleep so much, or you sleep a lot, hypersomnia, or you don't want to eat, lost appetite, or you binge eat, lack of energy, self-harm marks can also be one of the way they used to cope, right? But if they can't cope, then they will escalate to higher order kind of solutions, right? Which is the more adaptive solution of suicide. Okay, neglect of appearance, neglect of their ADLs, stop bathing, don't really care about hygiene. These are physical warning signs, okay, which can indicate depression as well and increase the risk. Digital red flags are dark posts, so don't take them as attention seeking now. Giving away accounts, delete social media, final message, online activity changes, right? Can also be red flags, okay, digital red flags. Um, or there's dramatic changes in online activity, right? So maybe last time used to use a lot, suddenly stop using social media, okay? And in such high risk situations, what lead to very very high risk situation is that previous suicide attempts, or if they have access to means, or there's recent loss trauma, exposure to suicide, and multiple warning signs lah, that has been said just now. Okay, can be high risk. What can we do? Okay, first thing is that we also stay calm, okay, and listen without judgment. I think Alvin has mentioned about this also, right? We should take all mentions of suicide very seriously, okay? Go with the angle of care and concern about their problems rather than trying to okay, sad to say some parents will even scold their kids, right? Like, how can you have this kind of feeling? You don't care about mommy anymore. How can you not care about the family? We all love you so much. But sometimes saying things like that just increases their guilt and shame, right? And they might, in the end up not being able to share their problems, right? Because they are so afraid that saying that they want to kill themselves lead to a lot of critical words, right? So we try to express care and concern, be open, listen without judgment. We can ask direct question, are you thinking about dying, right? Is there problems that you can't solve, right? Are you, struggling with your life? Are you having a lot of pain and suffering? Okay, direct question. Stay with them if in immediate danger, lah. Please stay close to them. If you know that they want to kill themselves, bring them to IMH if needed, call police if needed, right? Do whatever you can to save their life. All right. Uh, yeah, as mentioned, listen more than you speak. Uh, I think Alvin also mentioned, right? Some parents are very problem solving, like, no, everything can be solved. How can you do that? But I think it's better to just listen, okay? Validate their feelings. You must be feeling really, really sad right now. It must be very hard for you. Show that you care, okay? Be direct about suicide and offer help, and and that's what we can do. Okay, so don't minimize their feelings, for example, no lah, this will pass one. Don't just go and sleep. Tomorrow is okay already, right? Don't minimize that feeling. Promise secrecy, like, oh, okay, I will promise not to tell anyone. Just tell me. No, no. Then after you tell other people, it breaks the trust, and they will never tell you anything again. Don't give simple solutions. No. For example, oh, you're stressed about school. Don't worry lah. Don't worry about school. It's okay. It's okay one. Don't worry. Uh, and don't leave them alone, yeah, or don't act shocked or judgmental. Sometimes they see your reaction, right, also can make them not want to share. Okay. uh, I think it's quite important to manage parents' emotions. Parents are also humans, right? And they also experience very intense emotions when dealing with a suicidal youth, suicidal child. It's hard for them as well. And it's really normal to have fear and anxiety. It's okay to be scared, right? For parents who face such problem, you can, self-validate that it's okay to be scared. If you feel overwhelmed, this is actually very normal, right? It's a normal response in an abnormal situation. Think about self-care. You need to still take care of your own mental health as well. You need the strength to support your child, right? It's like the example of the oxygen mask, right? You should wear the oxygen mask yourself, then help others. So you should take care of yourself first before you help others. If needed, get support, you know, to be able to have all the resources to help yourself, help the child. Okay, so you can't pour from the empty cup, so you have to make sure that you're fine too, right? You cannot be, having suicidal thoughts yourself, right? If you want to help. Support systems, like family support network, family support groups, um, caregiver alliances, counselors. I think there's Caregiver Alliance is one of the parent support group. In school, there's counselors, there's teachers, uh, there's a team called REACH, REACH. I think it stands for Early Response, Early Intervention and Assessment for Community Mental Health. So the counselors have access to REACH, right? REACH is from MH and KKH and NUH. There's a north, south, east, west reach, right? So they can have access, and then the professionals can come down to do an assessment. Of course, there's IMH. IMH has an emergency room open 24/7, right? It's family service center in the community. Okay, building support system. Yeah, and there's 1771, that's the helpline, right? National Mental Health Helpline. There's MindLine, there's MindSG. You can just Google. Right. So yeah, emergency contact, MindLine, SOS, one SOS, right? 1767. Right. And with that, I stop share. Right. I think it's now time for Q&A, which I think is the more,
Yes.
more interesting part because there's a lot of questions.
Yeah, indeed, right?
Yes.
First of all, really a big thanks to Alvin and Brian, for this wonderful sharing. I think it's a topic that's very close to our heart. Maybe before I start reading the question from the Zoom chat, I just want to check in with Alvin first. I have a question for you. Um, with relating to the children and adolescent and youth, what are some of the services that's available for them, right, under Singapore Children's Society, and how do they have access to your services, Alvin?
So I think at Children's Society we have a wide range of services. So for children specifically, we have Tinker Friend, which is a hotline that kids can call into, primary school kids can call into to express any need for support or express what's going on for their lives. We also have drop-in centers. So we have drop-in centers across Singapore, in Jurong, all the way to Bedok. So these are basically spaces for youth, for teenagers to come to a third space for them to kind of uh, sh- seek support, spend time, engage in activities, meaningful activities in the community. I'm part of the YAT team, the Youth Integrated Teams. So my team is focusing on youth with mental health conditions. And also we are developing further programs for mental health literacy and mental health outreach programs for children and youth in the community lah.
Mhm. So how do they get access to it? Do they write into your website or go into your center?
So for Singapore, you just call in. For the job-based
Mm,
audits centers, they can just walk into any of the centers.
mm,
If they require mental health support, they can just sign in or go to our website. We actually can provide something called mental health check-in. So it's just a
mm,
quick QR code. You can just scan the QR code and book a session with one of our practitioners to kind of find out a bit more about what's going on for your mental well-being, your emotional well-being, and we have a conversation with you about it.
mm. Great. Okay, now I have an open question for both Alvin and Brian. Feel free to chime in, any of you. Recently, we've been seeing more and more articles with regards to how people are relying on AI when it comes to, for example, emotional support. And there's even an article talking about how AI may potentially encourage or increase suicide risk. So I'm just wondering if you observe that on the ground and what are your thoughts on this? Thank you.
Brian, you want to go first? So I think in terms of my experience, I think there's a new trend of like something called AI psychosis. So youths who experience suicide rates and looking for emotional support do go to AI, ChatGPT, Copilot to kind of express what's going on for them. So what I've seen an uptrend in is also how they then internalize the feedback from the AI does change how they perceive suicide or how they perceive the self-harm behaviors. So I think there's also been changes in the AI programming, the back-end databases, the language models to kind of if you do express suicide to an AI, the AI will tell you go and seek support. But I think how a lot of the tweens that I've worked with when they think about or they tell the AI about their emotional distress, the AI does try to validate them.
Mm,
And then they do withdraw or they say, oh, I like the AI more than talking to a person because of the validation that comes in.
mm. Anything to add on, Brian?
Okay, so for me, right, I actually also see this increasing trend of my patients telling me, right, no, I have no one to talk to. I don't talk to my family. You know, they will judge me, and I don't have much friends. So I actually talk to AI a lot, right? So, is that bad? To be honest, I think that is okay, right? Because at least it's some kind of support, right?
Mm,
When there's no human support. I don't know. Personally, I've tried talking to AI also, and it's quite helpful,
mm,
especially about the problem solving part, because they can be quite smart and rational. So what could be missing is really the genuine empathy and the emotional understanding, lah. You know, it can provide supportive responses, but you know, it's really generated through artificial intelligence. It doesn't really truly understand your experience, right? So there's also the fear of AI hallucination. I mean,
mhm,
saying things that shouldn't be said, right?
mm,
And there's also worry lah. What if the AI says something wrong lah? But hopefully in the back end, you know, they make sure that it doesn't encourage people to do dangerous thing, which is true. You can try lah. They usually will give helpline and you know ask you to seek help, right? But ultimately, right, I think our teens need genuine professional help. So AI
mm,
could just be a stopgap thing while they couldn't have anyone talk to, right? But it shouldn't be the main help that they are receiving. Yeah. So that's my stand. I think that
mm,
it can be helpful, but
mm.
it's better to seek real humans professional help. Yeah.
Okay, thank you for sharing. So from now, I'm gonna start reading some of the questions from the Zoom chat, and I want to encourage all the attendees to continue to post them, right? And later, after some time, you may even invite some of the attendees to ask the question live. Okay. So I have a question here. This is just it's an open question for both the speakers. Giselle, or I hope I pronounced that correctly. Um, she asked that you have to find out once we hear the idea that this person says that they want to kill themselves, or maybe they joke, right? They put in a way that is in a joking manner. Then how do we know that they are actually serious about this? And what do we then do with this information as well, especially if they make light of this whole conversation?
Maybe I start first, then Alvin can add on. I think, as I mentioned, right, whenever someone say something like that, we want to give attention. We don't want to take it like a joke, right? So, and of course, depending how close you are to the person, if you can really talk to the person seriously, understand, right? It could be really a joke, but it can also be a call for help. So I wouldn't take it lightly, lah, right? Especially if it's not something that the person usually joke about, right? It's not a common thing to joke about dying. So I would take this seriously. So if it's my friend, I will really, find a time to privately talk to the person and say, yeah, is everything okay? And talk about that. I'm actually a bit worried, lah, right? Is there thoughts to do something like that? Then and see how the person say lah, right? The person could say, no lah, I'm just kidding lah, no. Or
Mm.
the person could really say, yeah, no, actually I'm struggling with something. Yeah.
Mm.
Mm.
Alvin, anything to add on?
So I agree with Brian. I'll take it seriously, but I think I'll add on also that I'll try to kind of elicit out whether there's a more questions from more information about what the joke is about. So sometimes I'll
Mm.
ask like, oh, you joke about it, but have you ever thought about how you're gonna do it? So asking for
Mm.
method, or have you ever thought about when you're gonna do it? So asking for timing or is there a plan in your head? And most of the time when you ask very directly, have you ever thought about how you're gonna do it? They will tell you if there's a plan there.
Mm.
And they will be upfront and tell me, yes, I've thought about jumping or I've thought
Mm.
about taking pills. And that's where it can go into a deeper conversation. But or like what Brian said, they say, oh, I'm just joking and I already thought about it.
Mm.
Then you know it's a bit less serious.
So maybe just a follow-up question to Alvin specifically. When we're looking at children who are a younger age, on the ground for Caring for Life, we generally do hear concern from adults where they ask questions like, "What's your plan?" There is a concern from the community at large that whether will they plant that idea in a child's head, especially if they are young. So just want to hear your thoughts on this.
Yeah. So I think, thank you for the question. Similar to what Brian shared, if the thought was already there, asking them what's the plan would not plant the idea because it's already there.
Mm.
But
Mm.
if the thought was never there, when we ask them what's the plan, they will react quite strongly. At least the clients that I've worked with so far. If I ask
Mm.
them, have you ever thought about suicide? Have you ever thought about hurting yourself? And do you have a plan? They do react quite strongly if there's no plan. You say, no, I don't think suicide is not an option. Suicide is not something I would think about. But if the thought is there, if the plan is there, they are quite upfront, and you asking the question kind of gives them the space and the permission to talk about it.
Mm.
I think that's a very
Mm.
big thing also when we talk about suicide, is really creating the space and the permission for the other party to share.
Mm. Thank you. Okay, I have two questions right now on caregivers. I'm going to be asking them as in totality. So inviting both Alvin and Ryan to ask. So Chelsea asked, why do a lot of parents not want to approach the topic of suicide or mental health issue in general? And how can we help to reduce the fear of stigma surrounding suicide? And then with that, a follow-up question is by MHC, is that how do you also discuss with adolescent who has suicide ideation about speaking to their caregivers about suicide if the caregivers were not aware or they are not receptive to this information? So just want to hear your thoughts.
Why do parents not want to approach the topic of suicide? I think there's still a lot of stigma surrounding this topic, right? Especially from the older generations, right? And it comes from the misconception that talking about it leads to them doing it. So they try to not talk about it. So how do you reduce stigma? Join conferences like this one that we are in, read up more, right? Understand more. Go to CFL website, right, and understand more. SOS website, right? Basically, I think the antidote to stigma, right, is really education and knowledge, right? Once you know more about the topic, then the misconception, the myth, will reduce lah. Yeah. So that's from me. Alvin?
I think adding on to what Brian shared, so a large part of it is stigma, I agree. And I think part of it is also fear. So parents are afraid that if they ask a question and their child says, yes, I have suicidal thoughts, how do the parent react? What can the parent say? So parents also have that fear of, I don't know what to do if my child says yes. I don't know what to do if my child does express suicidal ideation. And that
Mhm.
also kind of restricts their willingness to kind of go down that road or broach the subject with their child. So then I think that adding on, responding to that, what can a parent do is really like what Brian said, like educating yourself. finding
Mhm.
out more, understanding what's driving the suicide ideation, and then how can we appropriately respond to a child who
Mm.
does express suicide ideation.
Mm. Maybe a follow-up question to that as well is that because in some agencies, I believe it applies to you as well, that when you detected that your clients have expressed suicide ideation or even how high risk to self-harm, you may actually inform their next of kin, which potentially could be their caregiver or parents. So I just want to check in with you on how that process is like and what's your general experience in this also.
Okay, so we always start therapy, right? In the first session, we share about the confidentiality and the limits of the confidentiality. So what it means is that whatever that you tell me, right, I will keep it confidential. Of course, I
Mm.
write it in the notes that other professionals can see, but I will not go and tell your parents whatever that you tell me, unless, right, there's something harmful, you might harm yourself or others, which includes suicide, or is something illegal is going on lah. Then I cannot keep it secret for you. So they do understand that.
Mhm.
And sometimes they say something and then you say that, okay, I think this is quite risky, right? I have to inform parents. They could immediately backtrack, they say, no, 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 I'm just kidding, right? But you know that actually they are just trying to stop you from telling their parents. And generally, I would still go ahead and talk to their parents or call them, really because we want to keep them safe, right? So that has to be done lah. But we have to do it
Mm.
in a very tactful way, right?
Mm.
So not to over alarm the parents as well. Sometimes they can get very alarmed when you tell them things like that. Yeah.
Mm. Anything to add on from Alvin?
I think for me, I think I've been quite lucky when I have to disclose to parents. Most of the youth I work with have been quite okay with me disclosing to parents. But I do
Mm.
ask the youth first, like, how much are you okay with me telling your parent? What exactly are you not okay with me telling your parent? And I do ask them, how do you think your parent will react if I tell them this? So then I'll process with the child or the youth first. What do you think? How do you think your parent will react? What do you think they would say before I eventually disclose to them? Yes, or disclose to the parent. And then the disclosure to the parent is also with the child and youth present.
Mm.
So I'll make sure that the child is there sitting with me in the room, the
Mm.
parent, and I make sure, okay, I need to tell you this is what's going on, this is what the child has told me. And I'll explain to the child this is really from a place of concern. I'm worried about your safety. I want to keep you alive. I want to keep you safe. That's why I need to tell your parents.
Mm. Yeah, thank you. Thank you for sharing with us as well this whole process. Ellison asked, I think this might be specifically to Brian. Should a carer or parents always resort to warding or admitting the child with mental health condition to IMH whenever the parents or carers cannot cope or struggling at times with episode of child's breakdown or self-harm? So, Brian, your thoughts, please.
Okay, of course, if they cannot handle and it's really risky, right, they should admit. But also bearing in mind that the admission depends on the assessment by the doctor lah. And admittably, right, our ward is small, right? So we also need to manage the ward. We cannot say everyone who comes in we will admit. If not, it will overflow, right? So I think it always boils down to the point. Do you think that you are able to keep your child safe? And do you think
Mm.
the risk is very high? Right? If it's very high, then yes. And we do have cases that keep recurring, keep coming back, as much as we hope that they can be able to stay outside, right? But the parents are just not confident to keep them safe. And of course, the doctor after assessment doesn't reject them, lah, right? Because we also don't want to lose a child's life. So of course, if you can handle her, then of course see what you can do, close monitoring, keep away the, whatever that is dangerous, the sharps, the medication, the detergent, window grills, all these things we have all these safety plan, so-called. But
Mm.
sometimes they really say I can't keep the safety plan. No, I have to go to work. And I feel
Mm.
very scared that they might do something when I'm not around. Then no choice lah. Then they will bring to IMH. Mm.
Mm. So, following on that, to both Brian and Alvin, so K, it says K iPhone. I'm assuming your name is K. What if the home is not exactly a protective factor? So I'm assuming that there could be, for example, domestic abuse or situation like this happening as well. So just want to hear from both speakers on this.
Alvin?
So typically, if we encounter that the home is not safe, we will try to identify safe spaces for the child or other alternative safe adults. So we do explore different network members, different adults, or different safe spaces with the child to see whether if the home is not the ideal situation, then we will explore alternatives lah. Even if it goes to the extent of removing the child from the home, we will go down that road if it's necessary, if we find it is necessary. But I think that's really the last resort that we're looking at.
Yeah, I agree with Alvin. It happens lah. We find there's really abusive situation. We might report to MSF, and then CPS will come in and to remove the child. But that's
Mm.
really last resort because it disrupts the child's life. But if he's really so dangerous and it keeps perpetuating the suicidality, we have to do what we have to do.
Mm. Okay, so I'm going to ask one last question from the Zoom chat, and then I'll open it up to the floor for the attendees to ask live. So from Carissa, my client has a teen daughter with high suicide risk. To avoid triggering and stressing her, he's adopting a permissive parenting style. Besides safety planning, how can I help my client set healthy boundaries and discipline with his child?
I guess the permissiveness, right, sometimes come from don't know how to say this, but some parents can be quite authoritarian, and then the child suddenly exhibit this kind of problem, right? Then they swing the other way, right? From very authoritarian to super permissive, right? Because they are very scared, right? And I think balance is the key, right? We try not to change too much also, right? But of course, it's good if you have been very authoritarian and always very critical. It's good to dial down this criticism. I think that doesn't mean that you don't discipline your child, but discipline your child in a healthy way, right? And not to think that you cannot parent anymore. Like no, it's also a bit of the power struggle. It's I think someone has mentioned, what if your child keeps saying, I want to die, and use it to so-called get whatever the child wants, right? So there needs to be balance in the parenting. They still need to do what they need to do. Uh, but if they are really suicidal because of whatever problems they have, then it's about listening and understanding their problem, right? But the boundaries still have to be there, right? Discipline still needs to be there. Yeah, that's from me, Alvin.
I agree with Brian. So like what Brian shared earlier about the emotional blackmail or the child using suicide as a way to get their emotional needs met. So it's understanding what's the function of the suicidal behavior first. And then, but in terms of parenting, I think I have seen parents also swing from authoritarian to very permissive, and the other way also from very permissive to authoritarian when the child expresses suicidality. But I think it's about balance and boundaries and structure are important for every child. So then
Mm.
it's not about then enforcing or being rigid about the boundaries, but being balanced and being kind of consistent in the boundaries. So then when
Mm.
the child recognizes that there's certain structure, certain consistency in your responses, the child's distress goes down.
Thank you. Okay, so I'm gonna now call to all the attendees. I already have a hand. So just a gentle reminder first that as you ask your question, do remember to practice the respect for the speakers, and this is also not for counseling session as well. Yeah. Okay, so can we unmute Angelica? Don't know if I get your name right.
Yes. Hello.
Okay.
Can you
Yes.
hear me?
Yes.
Hi. Sorry, I couldn't on my video, so I will just speak. So, yes, it's about talking about suicide. So, because I know so much about suicide, yeah, then I have I do worry lah when I speak to a child or a teen about the topic. Sometimes they don't understand. For example, oh, okay, what's your plan? Then they might not know what to say. I may say, oh, okay, do you plan to do it at night? Um, where will you go to do it? Then what if like your parents find out? Yeah, so I'm worried that because of all these things that I say, right, it might really like give them more ideas. Yeah, even about methods or let's say if um yeah, even for methods, like sometimes I worry that they may not think that I know much, so they don't want to tell me. So sometimes I will give example lah, like do you think of how you are going overdosing? Yeah. if you don't have like if you cannot go to the doctor to get medication, right? Are you going to just buy over the counter from the pharmacy? Yeah, just go Guardian and then gather a lot of different pills. Yeah. So yeah, I'm not very sure on how to deal with this.
This sounds like for younger kids, is it? Maybe Alvin can answer.
So I think for younger kids, if you're talking about suicide, it's really using child-friendly language. So I may not necessarily ask them, do you want to die? I mean, ask them, maybe I'll ask them like, have you ever thought of wanting to disappear? Have you ever thought
Mm,
about wanting to go to sleep and not wake up? So that's how I ask the suicide question. So in
yes.
terms of methods, I ask them, have you ever thought about how you're going to do it? So I won't be very strict about do you have a plan. I won't be very clear that or asking you about the time or the day. I just ask a child, have you ever thought about how you want to end your life? Or have you ever thought about what you're gonna do to kind of end your life? And they'll tell me, oh, I thought about jumping off, or I thought about taking pills, medication. Then I'll just ask them, okay, how did you plan on doing that? Or how did you want to get these things? What was going through your head? So I'll use very vague or very broad statements without giving specific examples of what they can do.
Okay.
Yeah.
Can might this apply to teens also?
Yes, I will refrain from giving them a suggestion lah. Are you thinking of buying medication to overdose? Are you thinking of jumping down? Are you thinking of getting a rope to hang yourself? I wouldn't say any of this, but I would say that, do you have any thoughts of ending your life? And how are you going to do it? So it's more of open questioning rather than giving them multiple choice lah. Yeah.
Okay, can.
Mm.
Thank you so much.
Thank you. Whoever has questions to ask the speaker live, just raise your hand. I'll keep a lookout for you. But in the meantime, let me just do a quick readout from the Zoom chat first. From Carol Lloyd. She's actually organizing this book club on the book of Anxious Generation by Jonathan Haidt. Covers at a deeper level of what Alvin and Brian have raised and how technology shapes childhood and parenting as well as their mental health, how children are anti-fragile and need a play-based childhood, and how social media, porn, and gaming impacts girls and boys differently. So more importantly, it covers what everyone can do for young, for government, etc. And she runs this book club on the book every month over Zoom in support of Caring for Life. There is complimentary access to everyone in this session only when you register before the end of conference today. Okay, so more information is here. You can look out for her chat. The link is there. And please use CFL at Payment Field. This is the background that she has listed as well. Another shout out by Tina Tan on this specific support group, right, called the Safe Space at SG Family. So the write-up looks is written as this: Are you a parent supporting a child, youth, or young adult experiencing anxiety, depression, school refusal, isolation, self-harm, suicide ideation or attempt, or any other mental health struggle? So you don't have to struggle alone. SG Families hosts a monthly support group for mutual support, and you can check out the link. It's under the Safe Space. Okay. Yes. So now next, may I invite Giselle? Sorry, I'm not quite sure how to pronounce your name.
Hello,
sorry.
hello, that's real.
Just
But
real.
it's
I'm
okay, no
so
worries.
sorry. Yes. Yes.
No,
Okay.
no, it's fine, it's fine. I just want to ask is because now with social media, there is actually a lot of like little kids that actually are aware of the topic suicide already. So then, so sometimes they actually talk about it lah. Then if we hear about it, then how do we even like talk to them about this this topic? Like how do we even like open up this? Like, do we open up this can of worms, or do we like? But they're talking about it already. So like, what do we do?
So I think I take this question because it's for kids, younger kids. So like you said, the can of worms is already open. The cat is out of the bag. I think there's no point trying to put it back. So then, as adults, if we hear kids talking about it, at least in our practice, if we hear clients talk about it or kids talk about it, we do talk about it openly with them. So, like I said, giving them permission to talk about it, giving them the space to talk about it, then we can address how they view it. And we can kind of challenge the thoughts that they have about suicide or the beliefs they have around surrounding suicide. And then we slowly destigmatize this idea that talking about it is bad. So then if they do have the inclination or the desire to hurt themselves or attempt suicide, they will come to us proactively. So when we create the space, where give them permission to talk about these things, then that allows children to feel this is a safe person that I can talk to about these heavy topics. And they'll be proactive in seeking us out to talk about it.
Okay, thank you. Mira, I see you. Just hold on for a while. Let me just ask one question to Brian. So Maggie, she asked this question. As a parent, can we be worried about having a child or youth who has been referred to IMH? Will they have any impact on their career prospect in the future? Then how can we balance the worry and getting the cure? And also a follow-up question, how will employers view mental health issues as well? So Brian.
I think their career will be affected if they die. So, or if they have mental health issues that's untreated. I think this boils down to another stigma of, seeking help for mental health, right? When we ask this question, if you seek help, for diabetes or for heart issue or for skin issue, will anyone ask, will it have impact on their career, right? No, nobody will ask, right? So to me, it's the same. Whether is it mental health, physical health, it's really health issues that needs professional help. And we should not be afraid to seek help. Technically, we should, I think companies shouldn't ask questions about mental health, right? That's according to, I remember President Halima talk about that in the tripeptide, right? These questions should be banned, right? They shouldn't ask about mental health help. And the records of IMH, right, is highly confidential. Nobody can see or know, right, the records. So to rest assured that no, the company cannot call IMH and say, hey, is this staff, a patient? We'll never answer that, right? Unless there's a crime, then it's from the law, lah, right, from the government, then it might be a different thing. But most of the time it's confidential. So can we worry about having it? Yeah, I think that I would be more worried if they have mental health issues that's untreated. I think that will impact their ability to max out their potential in life. Okay, so if they need help, they seek help, and then if they get well, and when they grow up, I'm sure they can get a job and do well in life, right? So my short answer is don't worry about it. Let's focus on what's more important. That's their health, right? Their mental health. Thank you.
Thank you. And maybe for the last question, may I invite Mira? Can you unmute yourself? Yep.
Thank you, Alex. I basically understand. I think from both presentation, I think when it comes to adolescent, is good to ask them directly, right? Are you suicidal? Rather than it's a myth that you shouldn't ask a adolescent directly that you will plant ideas to them. So I think I understand this very much. My question is there a guidance on how often, especially knowing a person who has attempted, right? Is there a guidance on, do you ask it like weekly, monthly, provided there's no signs. I think it's been very helpful and clear. The speakers have shared what are the signs, provided there's no such signs, maybe one or two, but do we go, how often do we actually go ahead and face it? How's, are you thinking of ending your life lately? It is awkward, right? So yeah.
Okay, I think I can answer that, and Alvin can add on. I wanted to say 3 times a day, but there's no hard and fast rules to such thing, right? Of course, you ask when you know that they have such thoughts, right? But I think what you're asking is the person has such thoughts, we intervene, and then everything is smooth, everything seems fine. How often do you check in with them?
Yeah.
I would say that rather than checking in, are you suicidal? Check in with their lives, right? How are you? How are things? How's school? How's work? Check in with their life, because their suicidal thoughts is really a solution to life problems. And if their life is generally okay, I think we don't worry about suicidal thoughts, right? And if they say no, there's stress, then we target the life stress. We listen to them, let them open up more, then we can understand more. And of course, if they start to say more things, then we are worried. Then we can ask the question, is there thoughts of, what are your solutions? Are there those thoughts of killing yourself? But I don't think that should be the main and most direct question you keep asking, right? So ask questions related to their life. Is check in with them. How are you? How are things? I think that's a better way to understand them, lah. Yeah, Alvin.
So I agree with Brian. Like I was more of we were checking the distress, and then how's things after her. I think when we first do the first suicide question, we asked the first time, we will do a safety plan. And in the safety plan, we will normally look at triggers. So what triggered your suicidal thoughts? So then in the future also we will ask, has this trigger been present? When you ask them about their life, ask them about distress, you will kind of look for, okay, is the trigger present again? Is it back? And then you ask them how you will be managing with this trigger. If they say they've not been managing the trigger, then you can ask the suicide. Have you been thinking about suicide as a way to manage your distress, your trigger again? But I think there's no hard and fast rule of or every 3 months or every week kind of thing.
Thank you. Looks like we have time for one last question. I'm going to read off from the chat. So Sahiruddin, he has shared this. He says that my spouse passed on from suicide this year. My 8-year-old doesn't know the circumstances of her passing as it was my spouse's wish. At some point, once she's more mature, I will have to let her know the truth. My concern is how to approach this and if my daughter will copycat the mother.
That's Zaharuddin, right? So very, very sorry to hear about this. It can be very, very painful, right? And I do understand your concern. Generally, I would think that is we don't want to hide it, lah, especially losses in the family. Don't want to say, this person has gone elsewhere, not coming back, or gone overseas. It depends on the age as well, but generally the time of rule of time is that to tell the truth, right? That what has happened. And in terms of copycat, I think it's really understanding that suicide is not just knowing about suicide that will lead to suicide. It's a very complex, multifactorial reasons why people consider suicide, right? But I think your concern about copycat behavior is very understandable, and it's actually shared by many bereaved families, lah, right? But I think it's a complex risk factors that lead to suicide, like untreated mental illness, social isolation, stress, uh, and not just about knowing that suicide has occurred, right? And also there's protective factors that will allow your kid, not to go into that direction, family support, ability to be open and to listen, right? And I think as they grow up, they will understand the circumstances, why maybe your spouse did, right? What happened, right? Why did the mother did that, right? It's also about understanding. Sometimes they could also have complex grief because of that, right? So it's important to watch closely your daughter, right? And see whether there's any behavioral changes or emotional changes, and how is she coping with school in general. Yeah. Alvin?
Yes. I'm sorry to hear about your loss. So I think similar to what Brian said, it's not a very clear-cut with direct link that she will try attempt suicide also. But I think it's also recognizing that the social support, the scaffolding for the child is important. We should not try to hide the suicide, the event from the child, but we should scaffold and use child-friendly language as we disclose, as we talk about it. I think also recognizing that talking about suicide as a family is very difficult. So you might want to seek professional support for the family. So then I know SOS has a good suicide survivors program also. Then it's about getting professional support and social support in place as you disclose this information to the child. So that the child also has spaces where she can talk about it. Because I think as a child, it both like what Brian said, recognizing the grief of loss. So the child might need to process the loss and process the suicide loss. And then make sense of that in multiple layers, which then would require a lot more support, professional support and family support, social support.
And to add on, right, I think Zahiruddin, right, is also like I mentioned, you have to self-care before you can care for others. So if you do need help, also don't hesitate to seek help and seek support, lah, right? Because it can be very tough to lose a spouse, which I'm very sorry to hear. So I hope that you can also seek your own help and be able to to stay healthy yourself. Yeah. Thanks.
No, I couldn't agree with that more. So maybe I just want to invite Alvin first, then followed by Brian, on some closing message for us. And also, if we have any further questions, how can we reach your organization as well? Thank you. Maybe Alvin first. Yeah.
So I think thank you for the opportunity to share and the opportunity to kind of provide more insight into how to support tweens experiencing suicide ideation. So I think my clear message is really as adults, we have a responsibility to the child. I think it's our responsibility to manage our reactions, to provide children the permission and the space to talk about what they're experiencing. I think if we can provide that space for the child will be able to be supported, feel validated, no matter what they're going through. And then suicide becomes a less viable option or less preferred option naturally, as they feel that they have other options available, there are other points of support available. So I think to contact Children's Society, I think you just go to our website, or you can just when we share the PowerPoint slides. I don't know if Alex you're going to share the slides. The slides will have our contact information also.
Maybe you can share with us right now as well. What's the contact information? Yeah.
So I think if you are keen to find out more about our services, you can just wait. Let me find. Okay, I'll just show a QR code. So a quick QR code that can just log in to book a session with us very easily.
Okay. Have you shown the QR code already? Oh, yeah, it's coming. Okay.
Yes, so just scan this QR code, you can book a session, you can find out more about our services and what we have available at Children's Society. Or you can find us on Instagram or even email us.
Okay, thank you, Alvin. How about Brian? Any closing message for us?
My closing message is that suicidal thoughts, suicidal ideations are really the tip of the iceberg, right? They are really solutions to problems that people cannot solve, and the pain and suffering, the lack of hope, and we should look into these things to help them rather than just outright trying to stop them from killing themselves. We need to understand why are they resorting to that, and provide a supportive figure, a listening ear, and be open, right? So that they will not be afraid to share about these things and to get the resources and professional help they need. I think it's very important. And do get support for yourself as well. Don't handle this alone, right? It takes a village to raise a child, right? And when such things happen, do get all the support you need, whether it's from schools, from professionals, from a family. Yeah. IMH, there's a national My Line 1771, right? If you need help, you can call that My Line. But usually referral into IMH is through either going to polyclinic, usually due to some kind of mental health disorders, or going to the emergency room, which is there 24/7. Yeah. So that's IMH. Yeah. Thank you.